I'm Morgan Greer. I am the Director of Clinical Services with Mount Rogers Community Services Youth and Family Services. We have 4 different sites in Whitfield, Smith County, the Fernwood area, which covers the Carroll County and Galax area, and then a Grayson County office. At these sites, we offer counseling services, so counseling for individuals and families with mental health or substance use issues. We offer case management services. This is to monitor, link, and advocate for the youth and their families' needs. We offer psychiatry services, which is for medication assessment and management, and that's in person and also via telemedicine. We offer mentoring, which is to role model for youth to build self-confidence and worth. We do parent education, which is a home-based service to educate and support caregivers. We offer behavioral therapy services, which assists individuals in addressing behavioral needs, and also provide therapeutic consultation for individuals diagnosed with autism. We have a crisis stabilization unit for youth called PATH. It is a regional service and offers stabilization for individuals who are experiencing a mental health crisis. If individuals are not interested in staying overnight, we also offer this in the community and in the home. We have youth mental health skill building services, which supports individuals in managing their mental health and to be successful living independently. And intensive in-home counseling is a service that's home-based counseling focused on preventing the youth from being placed outside of the home. And we also offer therapeutic day treatment services, which is a school-based service intended to increase functioning at school for youth struggling with emotional and behavioral symptoms. Now I'm going to turn it over to Ellen.
Hi, I'm Dr. Moriarty. I'm the Division Director of All Adult Services for Mount Rogers, and we mainly do mental health and substance abuse. We have 3 outpatient clinics, one in Wythe, one in Smith, and then one in the city of Galax. And we provide counseling, case management, psychiatric services. We have a unique team called the PACT team where they go out to the person's home and actually provide the medication for them. Somebody like that would have schizophrenia or bipolar, that it's difficult for them to come into the clinic. We actually have the psychiatrist, the nurse, and a social worker go out. We also have emergency services that if somebody is danger to self or others, then we go into the emergency room and we assess them to see if they need to go into the hospital. And they can go in voluntarily, or they can be what's called TDO'd, detained against their will. And we hope not to do that. We hope that the person will go willingly. With substance abuse, we have many levels of care. We have outpatient, but we have something called intensive outpatient, which is up to 9 hours per week, and that's really helping somebody get off a substance that they've been using for some time. Like Morgan said, we also have a crisis stabilization unit for adults, and they can stay there up to 15 days, and they can have substance abuse or mental health or both in that service. And then of course we have hospitalization. We have a new service called medication assisted treatment that goes along with substance abuse, and that's if somebody is having difficulty getting off particularly opiates, then they can receive this medication and outpatient counseling or intensive outpatient to improve their quality of life. We are also going to begin what's called a crisis stabilization center, or the crisis care center. It will be in Smith, where there's no barriers to treatment. Somebody can actually walk in intoxicated, and we will treat them with the hopes that they will stop using that substance. We have a tremendous amount of other services that for adults, if they have any intellectual deficits, then we have homes in the community where they actually live with us, and we have staff that stay there and take care of them. And we also have something called mental health skill building. We have psychosocial rehab. We have crisis stabilization in the community to where somebody might have feelings of danger to self or others, but they're not really meeting the criteria for the hospital. So we work with them until some of those feelings subside. And I think that is also peer support, and I think I've covered most of our services.
So one of the unique services that we provide as a CSB is the Industrial and Developmental Center, and that is we provide industry services where and supportive employment, and we make industrial items for different developers. So those cover the majority of our services through Mount Rogers. There's many more, but we would assess those needs as folks come into services, and the way to do that is to come in through same-day access. We have that every day, Monday through Friday, and the ideal times to come in is from 8:30 to 10:30 in the morning, and that's ideal because staff are dedicated to provide that service and to do an intake during that time. And those can take up to 2 hours, but that is the ideal time to come in for a same-day access intake. If you have any questions, you can contact our main office at 276-223-3200. Thank you.